Good afternoon, everyone. This is Batul from IJCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our stalwart who is present here with us today. Before introducing him, let us know about the topic for today's discussion. And the topic for today's discussion is vaginal microbiota and vulvovaginitis in female children. And to talk about this topic, we have very renowned doctor with us, who is a very renowned venereologist, Dr. Murugan Sankarantham sir. Sir is former professor, Department of Dermatology and Venereology, Sri Mukambika Institute of Medical Science, Kulashekaram, Kanyakumari District, Tamil Nadu. Sir is presently the senior consultant in HIV and sexual medicine at Tirunelveli, Tamil Nadu. Sir is also the former national president and Indian Association for the Society of Sexually Transmitted Disease and AIDS. So now, without any further delay, I would like to welcome this personality at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
Good afternoon. Thank you, Patul, for your wonderful introduction. And thanks for IJCP for giving me this platform to meet so many doctors in this pleasant afternoon. And today's topic is vaginal microbiota and vulvovaginitis in children. You may be wondering, yes, everybody knows that human genitals have contains a lot of microbiome. What is the wonder? Like that of our hindgut and oral cavity. But it plays an important role in normal health of a woman. That is very interesting. So we have to know something about that role of the vaginal microbiota in the normal health of the individual. Secondly, vulvovaginitis in children. Everybody may have an idea. The vulvovaginitis is more common in women, adults, and old age, especially because of menstrual habits, sexual habits, and old age, comorbidities, diabetes, multiple sex, all these things. But unfortunately or fortunately, it is not more common in vulvovaginitis is not more common in adults, but children are more vulnerable for vulvovaginitis. That is very interesting, and let us talk about that. Yes, milieu interior of vagina. The milieu interior or internal environment of our body system. It's not only in vagina, with the renal, with the blood composition, the renal, and also liver and lungs. Everywhere there is, even the skin, there is a normal interior environment is maintained. Because of that, we are having a healthy life. Similarly, the vagina also has to be maintained with a internal normal environment. The host provides a humid, nutritious, and warm habitat for the microbes. Whereas the resident microbiota produces antimicrobial and anti-inflammatory factors which will be helpful for the individual. This balance can be broken by internal and or external factors. The alteration of the host environment impairs its ability to control opportunity pathogens contained in the resident microbes. Normally, the favorable pathogens kept under check the pathogenic organisms that could invade the human body and cause illness. Hormonal variations can occur right from the childhood, adults, during menstruation, non-pregnant, pregnancy state, and during menopause. There will be fluctuations. All these things are quite normal in a normal woman. The vaginal microbiome is an intricate and dynamic micro ecosystem that constantly undergoes fluctuations during the female menstrual cycle and the woman's entire life from childhood onwards. As that of oral cavity and the hindgut, vagina also have a lot of microbiota by nature. Vaginal moisture, warmth, poor aeration due to the collapsible cylindrical tube by nature of the vagina, it becomes amicable for inhabitancy of wide varieties of organisms. The vagina harbors a huge micro ecosystem containing billions of microbes. The vaginal microbiota consists of varieties of organisms. The predominance of lactobacillus, actinomycetes, clostridials, bacteroides were observed in pregnant women. In non-pregnant women, the predominance of lactobacillus, actinobacteria, Prevotella, Veillonelliaceae, Streptococcus proteobacteria, Bifidobacteriaceae, bacteroids, and Burkholderies are observed. Some of the names you would not have heard at all. A wide variety of, among the lactobacillus also, we are having a wide variety of different lactobacilli are there. And they were typing as Lactobacillus crispus, Lactobacillus gasseri, Lactobacillus innes, and Lactobacillus jensenii. So wide variety of microbes are there and in millions. Role of this microbiota continues as the estrogen secretions after menarche increases the glycogen content of the vaginal epithelium. The lactobacilli thrives on this glycogen and multiply abundantly. Lactobacillus species flourish in the vaginal anaerobic environment and produce various antimicrobial compounds such as lactic acid, hydrogen peroxide, and bacteriocins, thereby contributing a healthy vaginal microbiome and establishing a defense against the invading pathogens. So that is very important basic thing. Increase in glycogen content. These lactobacillus thrive on glycogen, multiply abundantly, and produce various types of, that is, the vaginal epithelium is acidic, which also protects, and also hydrogen peroxide, production of hydrogen peroxide, bacteriocins, all these things offers a high degree of protection against vulvovaginitis in adult women. When this ecosystem of non-pathogenic microflora got disturbed, the individual will be susceptible for bacterial vaginitis, pelvic inflammatory diseases, vaginal moniliasis, preterm births, low birth weight children, baby, and miscarriages. Bacterial vaginitis increases the risk of some of the STIs such as herpes simplex virus recurrence, HSV2 recurrence, HPV, human papilloma virus, human immunodeficiency virus, that is AIDS, and chlamydia and gonococcal and trichomonal infections. So see, the normal microbiota, when disturbed, the individual is more susceptible to bacterial vaginitis, and the bacterial vaginitis made the individual more susceptible, more prone for getting these following STIs. So, estrogen in the vaginal mucosa increases the glycogen. This glycogen is utilized by the daughter-Lynn's bacilli, otherwise lactobacilli, which converts into glycogen, and this glycogen is utilized by these lactobacilli and produce lactic acid. This lactic acid is the reason for the normal pH of the vagina, which is around ranging from 3.8 to 4.5, and it facilitates the growth of the daughter-Lynn's bacilli, the glycogen content, and thereby this acidic pH and all these things put a check on pathogenic organisms. Lactobacilli protects interfering with the adherence to the epithelial cells. Protects by interfering the pathogenic organisms with adherence to epithelial cells and maintains the vaginal pH to normal, lower level, less than 4.5, which prevents the growth of other bacteria. The facultative anaerobic organism, peptone and Streptococcus, Bacteroides, Fusobacterium are also present in the normal flora. Whereas the facultative organisms are also present. Diphtherides, Streptococci, E. coli, Ureaplasma, Ureareticum, Mycoplasma. The facultative organism, what happens when the pH is changes, when the normal flora is disturbed, the facultative organisms can become a pathogenic one. So this is the normal physiology happens. There is a term called dysbiosis. The vaginal microbiome forms a homeostatic mutualistic relation with the human host and plays an important role in the vaginal health and also in the disease status. Dysbiosis is defined as imbalance in the bacterial composition, changes in the bacterial metabolic activities, changes in bacterial distribution within the vagina. So when the normal flora, expected flora, when it's disturbed, dislodged, then it is called as dysbiosis. The three types of dysbiosis are loss of beneficial bacteria, overgrowth of potential pathogenic bacteria, loss of overall bacterial diversity. Any factors leading to dysbiosis end with overgrowth of the pathogenic bacteria and fungal organisms, leads to the suffering of the individuals. So this is the basic thing we have to know about this. Dysbiosis can occur in situations. What are the situations? When it can occur? What are the reasons? The women of reproductive age, physiological changes such as fluctuations in the hormone levels, sexual activities, menstruation can cause variation in the vaginal microbiome. Apart from these, broad spectrum antibiotics, it not only broad spectrum antibiotics which are taken for something else, even for throat infection or gut infection, have action over the vaginal microbiomes also. That will disturb not only the pathogenic one, but also susceptible non-pathogenic normal flora also. So when it is get disturbed, the unaffected microbes, unsusceptible microbes for this broad spectrum will likely to be overgrown. Likewise, the antimicrobials used against anaerobes like metrogels, dinidazole also will cause and disturb the, I told about the anaerobic organism normally, Streptococcus, Bacteroides, all these things. So that will be disturbed. Once again, there will be likely to be overgrowth of the pathogenic organisms. And the vaginal pesticides, various types of vaginal pesticides, we are using for so many other conditions. Douching, cleaning purpose, over enthusiastic washings with soaps and antiseptics, oral contraceptives change the endocrine pathology, endocrine status. Steroids, once again, steroids lowers immunity, pathogenic organisms overgrow. And sexual activities will all have influence on the microbial flora. So one has to remember all these things. But one cannot exclude all these things. Suppose if this situation occurs, what we have to do? That is why we are emphasizing. Normal vaginal discharge. It's a healthy vagina contains small amounts of discharge which helps in cleaning and moisturizing, natural cleaning and moisturizing. Also has a protective role. Normal volume is around 1 to 2.5 cc. White or transparent, thick or thin, odorless, increase in amount during premenstrual period, that is physiological discharges, ovulation, during time of ovulation, during sexually aroused, in a pregnancy state, or some use of medications like contraceptives or like that. Likewise, once again, the vaginal discharge, normal vaginal discharge, usually clear, healthy discharge, pregnancy, ovulation, hormonal implants, or the gray bacterial vaginosis, pink color, you can suspect cervical bleeding, and whitish discharge, it may be candidiasis, yellowish green, that may be gonococcal or chlamydial infection. If it is frank red, menstruation, cervical infection, cervical polyp, so many things. So we have to have an idea about these things also. And one more thing I want to emphasize is vaginal wall has no glands at all. Cervix has glands, mucosecreting glands, racemose glands. Whereas we are having accessory reproductive gland, that is Bartholin's gland and Skene's gland. Whereas the vagina has no glands at all, no gland at all. Then the moisture is due to, you may ask, moisture due to cervical discharge or Bartholin's discharge. Not only that, it is mainly because of the transudate. Transudate can happen when the individual's blood flow changes, when she is sexually stimulated during pregnancy. That is increased blood supply because of the osmosis. It is like a perspiration of the skin. There will be transudate. It is not a secretion. It's an osmosis transudate. So that is the responsible for the moisture. So these are the things we have to know as a normal thing. And the vaginal pH is ranging from 3.8 to 4.5. So if it is disturbed, the individual is vulnerable for infection. This acidic pH, most of the pathogenic bacteria were unable to grow in this acidic pH. They will be destroyed. This acidic pH is caused by the lactic acid, which is produced by the lactobacilli or daughterless bacilli. The vaginal pH increases, lactobacilli decreases, aiding proliferation of pathogenic bacteria and candida, which may lead to bacterial vaginosis and thrush. So vaginal pH increases in conditions like bacterial vaginosis and candidal infections. No, bacterial vaginosis and candidal infections. Right, okay. Imbalance in vaginal pH can occur. Already we have mentioned. Once again, we are emphasizing unprotected sex. Semen is an alkaline media. So the vaginal pH is disturbed. So there may be favor for growth of the certain organisms. Antibiotics kill useful and harmful bacteria. Kill good bacteria and harmful bacteria. So because of that, the remaining unsusceptible bacteria can overgrow. And menstruation increases the pH because of the alkaline pH. And pregnancy, frequent use of harsh soaps and chemicals, douching, infections like bacterial vaginosis, trichomonas vaginalis. These two are more common in the increased pH. So these are the things we have to remember. And excessive conscious about our health, hygiene, vaginal spray, deodorant spray, scented spray alters the vaginal pH. The vehicles in this spray on creams can affect the vaginal microbiota. All chemicals. The fragrance and the scents associated with those products can irritate the vaginal lining, produce irritant vaginal vulvovaginitis. irritant and allergic contact dermatitis can occur, leads to pigmentations also. So one should be careful by using this type of cosmetic products. Similarly, vaginal douching using a high force jet, that also will be disturbed. It must be too much high, forceful, because it may disturb the normal flora and pathogenic flora present in the skin or external perineum, which may be pushed into the vagina further up. So this is all we have to remember. And flushes of the normal vaginal flora, that's also possible. Susceptible for various, once again, bacterial and fungal infections. The spa, vaginal spa is recommended in some places, especially in alternate system medicine. They are supposed to be good, but it's not so. Women squats and sits over the steaming water, which contains herbs such as rosemary, wormwood, and basil. They are not supposed to be taken. It's not good. Vaginal steaming is marketed with pseudo-scientific notions or balancing female hormones and revitalizing uterus and vagina. It is marketed as cleaning and vagina, which it does not do so. They were marketed, but it is not do so. So we have to remember. So this is about the vaginal microbiota. Now let us go to something about the vulvovaginitis in children. I told already in the beginning itself, vulvovaginitis is more common in among children. Why? The lining epithelium of the vulva vagina of the female children is a single layer of cuboidal epithelium, unlike that of the adults, in whom it is lined by stratified squamous epithelium. This stratified squamous epithelium offers a high degree of resistance to most of the bacterial infections, not viral, bacterial infections. So because of this single layer of cuboidal epithelium, it's more vulnerable, children vagina. Number two is already told, that is estrogen will be secreted only after menarche, whereas in children, the estrogen level is not very, very low. So because of that, the vaginal epithelium will be devoid of the glycogen content. So there will not be any lactobacilli. So the pH also remains alkaline in the vaginal child vagina. Because of this alkaline pH, child vagina is more susceptible for infection. The acidic pH once again offers high degree of resistance, whereas for the bacterial infections, which is lacking in children's vagina, where pH should be alkaline and made more vulnerable for infection because of the two reasons. One is lining epithelium and another is divide of the pH, that is acidic pH. In here, it is alkaline pH. Vulvovaginitis in children can be caused by various etiologies. And vulvovaginitis is more common in children rather than adults. Children with vulvovaginitis will be complaining of pain, itching, burning around the vagina, uncomfortable, and vaginal discharge may be present. Pain during maturation may be there because of itching or something like that. Vulvovaginitis in children can be caused by wide variety of organisms like bacteria, fungus, parasites, and due to irritant applications, skin diseases, sex abuse, and foreign bodies. Varieties of bacteria, fungus, parasites, due to irritant applications, skin diseases, sex abuse, foreign bodies. Challenges for the children with regards to vulvovaginitis. The vaginal orifice remains closer to the anal orifice, both in adults and children. Protective hair and vulval fat are absent or less. Poor hygiene among the children. Infants and toddlers cannot take care of themselves. Mother has to take, or parents have to take. the care. Customs and fancies of their parents have influence. Usage of diapers, pampers nowadays is very common, very frequent. Previously, it was not there. Diapers, when it's left for longer time, urine contact with the skin, motion particles contact with the skin. So these are the things, pampers. Cleaning habits of the mother vary, and mother's hand hygiene is also important. I've seen cases of mothers having vaginitis, candidiasis. When she comes out of the toilet after cleaning herself, the baby waits for cleaning, and without cleaning properly or washing her carefully, she may handle it, and child also will get the infection. And the washing habits of the genitals learned on their own, especially a single parent child. Mother is not there, father grown. So that child has to learn herself and taught by mothers. Some majority cases, the mother's teaching may vary, that also have influence. Certain illness exclusively for infancy and childhood, repeated diarrheal diseases. Bottom is always wet. The diarrheal diseases which is not cleaned properly, or the motion particles get entered into the vagina. All these things are more, makes the individual more vulnerable for vulvovaginitis. Other challenges like economic conditions, not wearing inner wears. Most of the low strata group, they may not having a habit of wearing inner wears up to the age of 5, even more than that. Inadequate cleaning. So without inner wears, when the girl is sitting on the floor or mud, or even the hospital campus I have seen in the mud or in the floor. So what will happen? The organisms get directly contact with the vulvovagina already, which is lacking adequate immunity. Inadequate cleaning. As far as possible, female genitals has to be cleaned after every time, always after any toilet procedures. If it is not being cleaned, they may irritate, or they may grow pathogens. Lack of water, another problem. Lack of privacy in big children. All these things, just imagine. And maceration, friction, maceration because of the repeated diarrheal disease, diaper use, pamper use, Huggies use, friction because of repeated washing, prolonged contact with the urine, feces, habits of putting fingers into the genitals playfully, clothing, children playing without innerwears, I told already, directly sitting on the ground. Worm infestation is another important thing. The pinworm or Enterobacter vermicularis is the commonest infection in childhood, and from the gut, from the anus, it will migrate to the child's vagina, and the child will rub it, scratch it, and produce vulvovaginitis, irritation, and post-vital dysuria, and foreign bodies. So this is not also uncommon. Children playing with pebbles, stones, writing objects, beads, grains, nuts, self or mutual insertion during play. So what will happen? It will lead to secondary infections, left unknown. The children does not know, will not declare, it will remain for days, and it may lead to foul smelling secondary infections. So that will cause frothy, purulent discharge. And lastly but not leastly, sex abuse. We are coming across so many news about the sex abuse, folks, things. So this is also happening. May lead to types of, actually, you see, the gonococcal infection in adults never causes vulvovaginitis at all. It causes only cervicitis, rarely urethritis. No vulvovaginitis. Whereas in children, if they are got abused, the gonococcal infection can produce a vulvovaginitis because of the pH and the single layer of non-stratified squamous epithelium. So these are the various types of vulvogenitis: moniliasis, diaper rash, and candidiasis. So these things are quite common in children. Irritant. So these are the things. So we have come across so many cases. It may be due to diaper rash. Diaper rash, usually the groin will not be much involved. All these things we have to remember. How to care these children? Wash the genitalia with water after every act of micturition or defecation. Dab dry with a soft cloth. Avoid chemical douches. A gentle non-soap cleanser can be used. Not soap actually. That is cinder bars. Once or twice a day during bath. Cleaning should be done from always front to back. This is also for both adults and children. Front to back, never back to front. Remember to dry all the folds. This is very, very important. The folds between the two labia, minora, majora, minora, clitoral hood, all these things has to be cleaned well. So the parents should aware of this and teach the children properly. So it is our duty as a doctor. We have to teach the parents. Parents have to teach their children. Ensure no fecal matter is left around the anus after washing. Supervision by mother is necessary then and there till she attains menarche. So up to the age of 10 or 11, we have to supervise them then and there. Then only they will be aware. Disposable diapers should be changed. Disposable diapers, that is Huggies or some other diaper, or during menstruation, early menstruation, other things, every 4 to 6 hours. A zinc oxide cream can be applied before wearing or to avoid rashes. All these precautions will help them to put them back in normalcy or remain normalcy. Natural remedies for vulvogenitis in toddlers caused by irritants. Suppose irritant vulvogenitis is there, soaking in a warm bath with no soap. Wiping front to back, not to back to front, after peeing or pooping. Wearing a loose fitting, especially cotton wears. Sleeping without underwears during night. So all these things are suggested to prevent the irritant vulvogenitis or other types of vulvogenitis. Further measures: cultivate the habit of wearing innerwears always during childhood onwards. Innerwears preferably be made of cotton in hot, humid countries. Train to change the innerwears daily. During washing, see that remnants of detergents not remain over the innerwears. That's also very important. Many times these remnants of the detergent in the fibers causing the irritant dermatitis. Periodic deworming is recommended. Avoid the usage of Pampers Huggies as far as possible. People tell only during the we are going out we are using. Many parents used to say, yes, say. But what happens? They will go for outings for hours together, whole day. What will happen? So this is all the sequelae we have to remember. Scope in the near future. Nowadays, techniques are being developed to assess the dysbiosis state. Thereby, we can even monitor the exact degree of the vaginal dysbiosis, and corrections can be made accordingly. Thereby, we can have a control over the bacterial vaginitis, PID, malignancies, obstetrical adverse happenings. So, thank you for your patient listening. I will be happy to answer if you have any queries. Thank you very much.
Thank you so much, sir. Thank you for answering that question and for making our viewers understand about the topic in such a better manner. We have received few questions from the participants. So with all your due permission, we would like to put across those questions to you. So the first question is related to potential long-term consequences. What are the potential long-term consequences of recurrent or untreated vulvogenitis in female children? And how can healthcare providers monitor and mitigate these risks?
I think my slides I have answered already. That is regular washing after every toileting act, and avoiding pampers use and these things, and wearing inner clothes, and cotton, preferably cotton clothes. All these things prevent hygiene, prevent good health, and unhygiene to be prevented. Avoid washing from the back to front. All these things are very, very important. We have to teach the child. The folds has to be cleaned correctly. And if we are keeping all these things, these children will be not be suffering from vulvovaginitis. So that is the thing. What is the other part? I think I answered. If anything left, please ask me once again, or you can put the question and screen. I can read and I will answer better.
Thank you so much, sir. Thank you for answering that question. We will move to the next question. And the next question is related to specific preventive measures or hygiene practices that parents should be educated about to reduce the risk of vulvogenitis in their female children.
Once again, the same question, I think. And we have to maintain the that is washing habit. Teach the children from the toddler onwards how to change, how to wash their inner wears, how to wear, how to wash, all these things. And especially when the baby is having diarrheal disease, keep it dry always, and wash, see any leftovers not present in the vulva vagina. All these things are very important. And we should not give haphazardly any antibiotics to prevent the diarrheal disease. And if it is so, we have to give a short course. And we can also give probiotics either in the diet or in the pessary-form probiotic. Simple curd will increase the normal flora regain. So that will also will help. All these things put together, put them back to normal. And suppose if it is irritant dermatitis, irritant vulvovaginitis, we have to avoid the irritants, douching or washing or soaps or thing, and putting some mild steroid cream, if necessary antibiotic cream for a short course. It will be do good. Okay.
Thank you so much, sir. Thank you for answering that question. The next question is related to the key differences. So, what are the key differences in the vaginal microbiota composition between prepubertal girls and adult women?
Once again, the prepubertal women, they are lacking estrogen. And because of the estrogen lacking, their vaginal epithelium is devoid of glycogen. So there will not be any lactobacilli. The good bacteria, useful bacteria, flora will be absent or almost nil. So because of that, the prepubertal children are more vulnerable. Whereas in after women, that is a menarche of the estrogen action, their epithelium becomes rich with glycogen content, and this glycogen is replaced by this bacteria of lactobacilli. Lactobacilli present abundant in the adult vagina, which is responsible for the production of lactic acid and hydrogen peroxide, which offers a high degree of protection. And also this lactic acid is responsible for the acidic pH 3.8 to 4.5, which is also giving high degree of resistance to bacterial infections. So thereby it helps. Okay. Hello. Batul, I'm not, you are unmute, you have to unmute.
Yes, yes.
Ah,
Thank you so much, sir. Thank you for answering that question. The last question before we conclude the session. And the question is related to the use of antibiotics. So, how does the use of antibiotics impact the vaginal microbiota in pediatric patients with vulvogenitis? And what strategies can be employed to minimize the risk of dysbiosis?
yes, yes, this is very important. We must be very careful in using antibiotics. If we are using antibiotics, broad spectrum antibiotics, we have to give probiotic along with that and B complex. So this will retain the normal flora as early as possible. And this broad spectrum antibiotic should not be given for longer time. So these are the precautions we have to follow. Otherwise, the system, the normal system, the ecosystem, the bacteria, flora will be disturbed and the overgrowth of bacteria and fungus can happen. So broad spectrum antibiotic, now that is narrow spectrum antibiotic like previously the penicillin, amoxicillin will not do much, whereas cephalosporin, tetracycline, doxy, other things may disturb the flora, and we have to give a short course and we have to restore the normal flora by giving probiotics and other things. And after some time it will be the girl or woman will back to normal and restore the normal flora.
Thank you so much, sir. Thank you for answering that question and all the other questions for our viewers and making them understand the topic in such a better manner. Thank you so much for that. And I would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session and putting across such interesting questions to us. And I would like to thank you, sir, for taking out your valuable time and for being here at our platform and sharing such wonderful insights upon the topic with such a overwhelmed presentation that you have shared with us. Thank you so much for that, sir. Thank you.
Thank you. Bye for all. And I want to know how many participants joined that. Please let me know. Thank you very much. I'm leaving.
Thank you so much, sir. Thank you. With this, we are concluding the session here for today. Until next time. Thank you